not sure if you guys remember. Oh, that sun. That's no better. All right. About a year ago, I shot a video about pharmacies not filling medication, and I wonder if it's any better. Well, at least I know where I'm at, it's not any better. If anything, it's probably a little worse. But I'm at the same conference I was at a year ago, which is what got me thinking of that video. And you know what? Every time I drive over here, so I've been here a few years in a row, right? But specifically just this week, as I'm driving over to where the conference center is, I've basically gotten lost 3 times in a row. So we'll see if today makes 4. I don't think so. I think I got it figured out now. That's kind of embarrassing. I'm horrible with directions. But it's just like there's lots of, I don't know, twists and turns. I get turned around easy. And everything looks the same. So, heading there this morning. Got a meeting first, a board meeting. Then I'll have like classes or whatever, you know, to learn. So I got my little Florida shirt on that my youngest daughter bought me for Father's Day and makes me wear all the time. But hey, it looks cool. So what can you say? So, all right, anyway, I'll check in with you later. So I've been in class all morning. And this conference, this is not an addiction conference. It's actually just kind of regular medicine. So I've been learning about atrial fibrillation, hypertension, diabetes, you know, just kind of the latest and greatest. New medications coming out, you know, just new studies and things of that nature. So it was a good conference. We had some interesting speakers, particularly a guy who talked about nutrition and diet and preventing heart disease, etc. So anyway, all in all, a good time. Now see if I can remember where I parked. All right. But we were talking about pharmacies. And since a year ago, you know, I talked about I wanted to start a pharmacy in my clinic. I have not done that. I've not even moved anywhere close to doing that. I do think it could be very helpful. But anyway, I'm just wondering if it's gotten any better or worse for you guys out there with your pharmacies. Let me get my keys out. And specifically, I want to talk about if pharmacies are being unethical, or specifically pharmacists being unethical. And let me tell you, if they're treating you different than any other patient, they're being unethical, okay? It is really, it's not for them to make medical decisions for you, okay? Now, their role is very important. And I've got, like, one of my best friends is a pharmacist. Brilliant guy. Pharmacists are important. They help to monitor, like, all your medication, make sure there's not interactions. They want to make sure you're getting the right medicine that was ordered, make sure, you know, the dosing is safe, etc., okay? And that is very important because sometimes it's easy for people to make mistakes. It's easy for doctors to make mistakes, and pharmacy is a way to double check a lot of that, okay? But it is not their role to tell you that you cannot take a medication for the treatment of your addiction, all right? That's unethical, it's wrong, And if you're meeting that kind of resistance, you know, you've got lots of options. One, I don't think just getting really upset is going to help you any, okay? But one thing I think you could just ask them is, and just say to them, look, I'm trying to do better in my life, and this is helping me. You know, why won't you help me get better? Or, you know, something along those lines. Why, you know, what is your resistance to me in my recovery? Or, you get where I'm going. You know, I just, there's lots of things you could ask, lots of ways you could say it, but just basically by asking a question, put it back on them. Now, they may have an answer, and it may not be a good answer, but it's probably going to reveal their personal bias. So, pharmacies have a lot of leeway in what they can do and what they can't do, but it still doesn't make it ethical. Okay, even if it's legal, doesn't make it right. So I think you need to push back a little bit if you feel comfortable doing that. Assert some of your rights. Talk to your doctor if you're having issues at the pharmacy level. I know I've spoken to pharmacists. I've helped to explain to pharmacists about the treatment because they just had no clue. And some of them seemed very receptive to understanding. I've got one pharmacist that I use a lot who was very accepting and has actually even told me, like, years after the fact that he's really seeing, a difference in what we do. And so he's been very supportive of helping patients get off opiates, all right? But I've also hit walls. I've talked to pharmacists at, I don't want to name any names, but Walmart, that, they basically, practically told me they didn't care. That they could make the decision themselves and that they were not going to fill the medication. Even when I, tried to explain what was going on. So, you're going to hit obstacles, guys, and that's the way life is. Whether you're a patient or whether you're a doctor, nothing is ever going to go perfectly smooth. But I think we can come together and try to work to having some understanding, to try to get the word out that there's nothing wrong with being in recovery, okay? That there is nothing to be ashamed of if you're on medication assistance, right? And even if you're not tapering right now, there's nothing to be ashamed of. If you're following, your instructions, you're working with your doctor, your counselor, you're working on your life, you're getting things ironed out, right? You're making these huge improvements in your life. You've got nothing to be sorry for. And you can be an inspiration to somebody else, okay? Because some of you out there who watch this video, you're going to have the courage to stand up, right? And some of you are going to be very shy. So those of us who have the courage to stand up, let us stand up for our brothers and sisters who are embarrassed and shy, and let us be that example, okay? And I wish I had this quote. There's a quote by Ralph Waldo Emerson, and it's something like, the purpose of life is not to be happy, but it's to be useful and honorable. And there's more to the quote than that, but that's all I can really remember right now. But that is so true, right? I'm gonna put that quote, I think, I'll put it in the description. I'll try to find the full quote. I hope that's a real quote. You know how, like, sometimes you read a quote on the internet and it's like completely made up. And this is a side note, but I think Abraham Lincoln once said that like 75% of all statistics on the internet are made up. But I don't know if that's true. I'm just kidding. That was a stupid joke. But anyway, just seeing if y'all are paying attention. So, I'm done with my conference. I'm gonna go spend some time on the beach with my kiddos and my beautiful wife, and I'll head back to Mississippi in a few days, get back to practice, get back to the real world, treating a little bit of everything, and just trying to make the most of this life, guys. That's all we've got. Let's do it together. All right.